Honorable Mayor, Town Council, guests, citizens of Belhaven, area citizens, and hospital supporters. Thank you for asking me again to present an opinion on health care in the Punga District and Hyde County service areas, involving a population of 20,000 who are mostly poor and old, representing a medically underserved and economically deprived area. Why am I qualified to make a statement on local health care needs? Having been a physician for 53 years with 49 and a third of those years here in Belhaven, attending thousands upon thousands of patients, working virtually and on call 7 days and nights for most of these years. With duties on the hospital staff, covering the emergency room and managing the clinic with 3 physicians and staff of 22 employees, serving as medical director of Hyde County MS Hyde Health Department Cross Creek Nursing Home probably qualifies me to say something and have some insight as to what type of health care services are needed in this area. Yet, not a single person in the Vidant operation has sought any local input on medical input on health care or Vidant Punga Hospital closure. My experience as mayor for 30 years and town council member for 7 years also provides some knowledge on local government, politics, and economics. Serving on many committees with the North Carolina Academy of Family Physicians and the North Carolina Medical Society, and being president of the Academy has provided me expertise in health care far beyond the local and regional areas. Now that I'm probably qualified to comment on health care in the Punga District, just what is my opinion on closure of our hospital? Punga District Hospital, and more recently, Vidant Punga Hospital, has served our people for 65 years as a well-recognized community hospital, classified as a 49-bed acute care critical access facility, established as the first Hill-Burton hospital in the United States, opening in 1949. Hospital services have been comprehensive and include emergency department, modern lab and x-ray, endoscopy, cardiology, nephrology, physical therapy clinics, along with vent beds, rehabilitation beds, psychology services, etc. Of all departments, the emergency department is the most significant due to the vast service area involving all of Hyde County and eastern Beaufort County, with a high incidence of heart disease, strokes, water and farm trauma, hypertension, diabetes, and chronic obstructive pulmonary disease. To repeat, this area is medically underserved, and our people chronically economically deprived, 85% Medicare and Medicaid, representing mostly the old and the poor. Due to budget problems, but with still positive finances, meaning that all bills were paid, we had a little bit of money left in the bank, affiliation was sought with University Health Systems, now Vidant Central. The contract, as reviewed on multiple occasions by the Board of Trustees, the administrator, and the medical staff, provided for the following conditions and was favorable and well received in 2012. This contract, as implemented in 2012, provided the following: Punga District Hospital will not be closed. Administrative assistance will be provided. Outpatient clinics will be added to those present. Purchases of medical supplies and equipment will be cost-saving through Vidant. Medical training programs will be added. Mutual support will be provided. Medical record system will be installed at the hospital in 3 clinics through a grant made to Vidant. This has been completed at the hospital only, not at any of the clinics. Hospital physical plant will be updated, repaired, and maintained. Staff recruitment will include physicians and nurses. Significant capital improvements and the physical plants were to be done. The Vidant Pantigga Creek LLC contract has been violated at every provision of this contract. As a result of this contract breach, healthcare deprivation and economic disaster for our town, area, and our people looms on the immediate future. Then comes the shocker. after the first year of Vidant affiliation. Vidant Punga Hospital will be closed in April of 2014, and our full-service acute care critical access hospital will be replaced with a primary care clinic, not a multi-specialty clinic as has been advertised, with no emergency services. And that's the main point that we are missing here. No advice was sought locally, and the decision was unilateral and final by Vidant. Word from Vidant was that there would be no compromise except the hospital closure with loss of all assets, and accept the proposed primary care clinic with no emergency room, or otherwise Vidant would pull out all support and leave the entire area without health care, as they also had gained control of the 3 local medical clinics. No communication was made to the medical staff or other hospital personnel prior to the announced closure. Little effort was made to fully honor the 2012 contract as it was drawn up and signed by the University Health Systems at that time, which is now Vidant Central. Vidant would control all bank accounts and accounts receivable, and just recently they would also be given the hospital building, the grounds, and all equipment amounting to millions of dollars. I'm frequently asked how I feel about the closure of our comprehensive community hospital of 65 years being replaced with a primary care clinic and an urgent care and no emergency room. First, I feel sad and I feel bad, then disappointed with the breach of contract by Vidant and their failure to communicate and the failure to correct plant and financial deficiencies early on. Then I'm angered with the threats of loss of health care for our people who have poor access to care beyond Belhaven. The lack of updated EMS services in eastern Beaufort and Hyde counties with the loss of the Golden Hour in emergency services and transport remains a dominant factor in the Vidant Punga Hospital closure. Also, additional loss of specialty clinics, diagnostic lab, and x-ray units, plus the latest announcement of loss of the building, grounds, and all hospital equipment simply adds fuel to an unpleasant situation. Our people in our area would have fewer health services than 65 years ago, with Punga District Hospital and 4 physicians providing health care to the area. Recruitment of physicians and medical personnel will be near impossible under the present circumstances and proposals with no hospital and no emergency room. The town of Belhaven will be severely and negatively impacted economically, with $400,000 loss in utility services, loss of retirees and their investment, loss of 100+ employees, with more job loss looming ahead. A small primary clinic is not an equal trade-off for a 49-bed acute care critical access facility with emergency department, multiple clinics, full lab, high-quality x-ray services, and other positive attributes. And now, our Pantiga LLC, created to save and protect the stockholders and the people's investment. Along with Vidant Central, has just announced that all assets of our community and People's Hospital has been signed over to Vidant, including the building, the land, the investments, the accounts receivable, and the hospital equipment valued into the millions of dollars. This is not a fair trade-off for a clinic with limited services, even with announced cost of $4.2 million for the clinic as it is now. The hospital property and building and equipment in there has been valued at $9.6 million. So there's a tremendous difference in equity between the two comparisons. So it was also estimated that the new clinic would be losing $1 million a year in operation for several years. We were only losing $1 million or less than $1 million, $600,000 and up to $1 million at the hospital with a full service operation, and that would open 24 hours a day, 365 days a year. We had tremendous services that I've just reviewed for you, and under these certain conditions that we have now to operate with the healthcare situation as it is, we did lose money, but we're losing less money than Vidant has indicated that would be lost in this new clinic that's proposed. And I'm supposed to be happy, pleased, and satisfied and appreciative with Vidant's breach of contract. reduction into health care for our people, and economic disaster for our town. I know what it means to be able to pay town bills. When I became mayor a few years ago, we didn't have enough money to pay our bills. We had to sit down and sort out what bills we were going to pay from week to week until we could get our heads above water. Of all considerations, loss of the emergency department services remains the most critical factor and my greatest concern for the health and welfare of the people. I personally am hurt, disappointed, unhappy, and internally angry with the destruction of health care in the Punga District Medical Service area, affecting 20,000 persons, with 85% of those being old and poor, coupled with an impending economic disaster for our town due to loss of jobs and businesses and a significant reduction in municipal income. All of this is occurring right before us with virtually no local input or arbitration. Take it as it is, as we have decided, or we will pull everything out decision, leaving our people and a destroyed healthcare system and a destroyed economy. The hospital closure certainly will have the following economic effects on the service area, and I always include all of Hyde County and eastern Beaufort County as our service area. More than 100 jobs lost with more to come, $400,000 in utility bill charges and other lost revenue for the town of Belhaven. Loss of retirement population relocated into Belhaven. Closure businesses, loss of jobs and population and services. Population loss. Increased cost of health care services for those forced to travel long distances for medical treatment and services, especially those who cannot afford the cost. Everybody doesn't have a full tank of gas in a car out in the backyard ready to make a trip. That represents 85% of our population right there that are in difficulty as we consider the closure. Now, in addition to the significant reduction in municipal income, all of this is occurring, as we've said, with no input and no communication. I agree with Dr. Ben Carson on healthcare philosophy. Get the government and financially motivated big conglomerates out of healthcare and let the people decide for themselves what health care they would like to have and what is most appropriate for each community. It's easy to sit in another county and have a discussion around a conference table about what we need in this service area. They do not have an understanding of what it's all about, and that's where the problem is. If they had come down and lived and discussed and known something about our people and what we need and what we are put up against economically and medically, I think that they would have had a different decision. But it's easy to sit in the hall of plenty and make decisions about what you're going to have and what kind of meal you're going to eat and how often you can eat in a day. And that has to do with that as well as health care. So Vidant, please don't do our people and our area any more favors regarding health care. It has been disastrous. Simply return to the contract you signed and do no more than you promised. If they could only realize that. Because if any of us are not worth our word, we're not worth much else. And if you promise and sign a contract that you will provide these areas of service to our area and our community, as I have read them out for you, that's what I expected. And frankly, I was chief of staff when this decision was made and the contract signed. I know what we discussed at those meetings. I know what notes that I took said. I know what the contract provided for. And it was a very satisfactory, healthy contract, good for our community and our area, should it have been attended to. But the contract was not followed, and it's not being followed now, and we have just become involved in the process of giving everything else we got away, which represents the community assets, not just the LLC assets. They only have a piece of paper with a certificate of shareholder certificate. the people of Belhaven are the ones who've contributed to that hospital and made a hospital a hospital. We have worked long and hard. We've gone out and gotten all sorts of grants and programs and fundraisers to have all of the x-ray equipment that we have over there, which is second to none for a small community hospital. So that's what I'm aggravated about. We should not trade off a $9.6 million acute care critical access hospital with emergency room, helipad, clinics, x-ray lab, and 49 beds for $4.2 million primary clinic with no emergency room. If you're going to have good health care in Belhaven, in this area, you gotta have an emergency room. You can't do it with urgent care. You can't do it in my office. I know, and I've been there. We can do better. And the generation before us did better. In 2 years, they created a hospital and had 5 doctors here. We won't even be able to bring another doctor to town, I don't know in what number of years. You might get some that would be assigned to come and take care of the people in the area. But as far as having a physician who wants to move to this area with their families and become a part of the community, they need to have a little bit more security than what is upon us today. I thank you for your time and your patience and courtesy of not interrupting that tonight. It's pleasant to be with you. Thank you.